Okay, well, thank you so much for having me. It's like such a delight to be here at this launch event and to hear about all the ideas and activities for the Stone Center, TRE, as it goes forward. And I'm just delighted to talk to you today about some work I've been doing, but really more of a survey more broadly of work beyond just work by myself that sort of fits in the bucket of thinking about the social safety net, which is, of course, a critical element of that third element of the Stone Center about remedies for inequality, relates to how we use the social safety net in virtually all developed countries. And I want to start with a sort of observation about the social safety net in the United States, and I'll make a bit of a comparison to Canada, and sort of use that as a starting point for thinking about the sort of emerging research that we have across many countries, trying to quantify what the long-term benefits are of doing more social safety net activity towards children. So if we spend more money on children when they're young, children, to what extent does that translate to differences in their life trajectory? And if that's true, then how should we think about rolling that in to our perspectives on, are we doing enough? Do we have the optimal policy in our current portfolio? So that sort of framework of thinking about policies as investments is oddly very common in some domains and very uncommon and very scarce in other domains. So, if you're talking about, say, the expansion of early childhood education, it's very much discussed in the policy arena in this sort of framework. It's going to take some money to kit up these, early childhood education programs. We need to build schools, hire teachers, but that's going to, generate returns. Kids are going to show up at school more ready to learn. Maybe there's going to be less disparities across groups, and that's going to lead us on some kind of upward trajectory that's going to be good for kids in the long run, and by the way, possibly good for society, because when you earn more when you're an adult, that generates more taxes, less spending. That is the investment lens to think about human capital investments. But we don't really think about the social safety net and use that term investment with it. But I hope maybe by the end of this talk, for those of you who aren't, informed about this kind of work, might see that perhaps we should. And I think the evidence supports it, and I think it'll be interesting to see the extent to which it makes it an easier way to communicate the value proposition to a broader group of folks. So what I want to do is sort of give you a kind of wide but maybe not very deep review of what we've learned in the domain of when we spend more on kids in programs that are cash or cash-like or these kind of anti-poverty programs. To what extent does that translate to differences in their long-run trajectory? So that's the plan. But I want to start with something that sort of helped give me some perspective on this question. So here is just basic data from the OECD. On the horizontal axis, it's the OECD's calculation of what share of a country's GDP do they spend on family benefits, which is kind of the closest thing to what I'm going to be talking about today. Cash assistance, child credits, things of that sort. And then the vertical axis is what is the child poverty rate in that country, with an attempt to try to calculate them in similar ways across countries. And okay, I'm from America. I mostly study programs in the United States. And the really clear thing that you see from this graph is what an outlier the United States is. We simultaneously have very low spending as a share of GDP on families and children, and very high child poverty rates. Canada, interestingly, is kind of, middle of the pack, maybe just slightly below the median. But you see it's a different set of outcomes. And this is just data, but as I like to say, it's not really rocket science. You spend more and poverty goes down, and that's a pretty unsurprising relationship. Interestingly, if I were to show you the same figure, but instead of it being poverty rates of children, if I had poverty rates of elders and the share of GDP that's spent on programs targeted at the elderly, the United States is not an outlier. We're kind of middle of the road. So really where we're different is our spending on children. And I worked on this paper for the Journal of Economic Perspectives, a very simple, descriptive, kind of weirdly navel-gazing paper, where myself and my co-authors, Anna Iser and Adriana Yarasmuni, we were all people who had sort of worked in this space of kind of poverty and social programs. And we were talking about why it is that we thought there was so much emphasis in the literature on measuring how these programs affect outcomes in the structure of the delivery of them. Notably, most of the research is focused traditionally on, if I structure a program a certain way, how does it affect how much the parents work when I deliver this benefit? And how, if I structure the program differently, might it lead to different outcomes in parental employment? So it was our kind of perspective that the literature had historically been very focused on what we called the incentive effects of programs, not only effects on earnings, but also effects in the United States anyways, very much on marriage and fertility. So there's kind of three things that we spent a lot of time focused on. And oddly, very little attention to what benefits spending on these programs might generate. And so we dug into 50 years of data from journal articles and sort of top general interest journals, and then all the sort of top field journals that would do work in this area. And we quantified each paper on anything having to do with the social safety net, and we just tagged them with whether or not it was a paper that studied the incentives of the program, like how does cash welfare affect maternal employment, or was it looking at something having to do with what benefits are derived from this program. And what we found was a quantification of what was evident to anybody who'd been working in this area, was that we really focused quite a lot on the incentive effects of the programs, with very much less attention to how the programs improve outcomes, or if they improve outcomes. And what's really kind of particularly strange about that, in retrospect, is that these are policies targeted at kids, but kids weren't very much part of the study. They're really a study of parents and parental behavior, which is not unimportant. You know, if a program generates sound benefits for kids, we're going to want to figure out the most efficient way to do that. And so essentially, we were spending quite a lot of time on the efficiency, on the distortive effect of the distribution, without the countervailing attention on what benefits the program generates. And so it struck me that, well, how could we come to any reasonable kind of thinking about whether we're doing enough of something or not enough if we're constantly measuring the incentive effects without also measuring the benefits. And so that is like, you can tell that I'm going to show you data for the last decade of this period, but historically, we've spent a lot more time on analyzing the incentives of these programs. And if I think about the very first paper that I saw that measured the benefits of a program, it was the early work by Janet Curry and John Gruber, who studied the effects of an expansion of public health insurance in the United States for pregnant women and children, and they quantified not how expanding this program affected the employment, marriage, or fertility of the parents, but instead how it affected kids' outcomes. So when pregnant women had access to this additional health insurance, did they have healthier births? And when kids had access to this health insurance, did they grow healthier? Did they experience improvements in health? So that's the first thing that I remember seeing. And from there on, there was this kind of rippling out of a lot of research that initially was very focused on more contemporaneous outcomes. When we see a change, to what extent does it translate into kids showing up more for school, maybe doing better on test scores today, more contemporaneous outcomes. What happens to food insecurity in the household when benefits are expanded, say. And so a very 35,000 foot sort of summary of that work in the United States is like we learned a lot about short-term impacts of these programs, from the Earned Income Tax Credit to food stamps or SNAP, to effects of Medicaid, SSI, other programs. These are sort of cash, near cash, or in the case of Medicaid, public health insurance, which is really central in the United States, given that we don't have national health insurance. And so a wide range of sort of contemporaneous outcomes were studied as this literature sort of expanded, looking at effects on child health at birth and going on from there. And you can see other kinds of measures in this sort of summary slide. But the work expanded beyond that to kind of look at more long-term effects. And so really what I want to talk about today is diving into what we know through this lens of a bit of more of the sort of intergenerational inequalities and intergenerational poverty, and the question about, if we do more spending today, does it make a difference to where a kid ends up in adulthood? That is the kind of summary that I want to talk about today. And so I'm going to sort of give you a little bit of a quick summary of the kinds of work that I've got listed in this slide. So now, where we sit today, which is going to be what I'm going to be able to talk about in this review, is that things have really turned absolutely upside down. Right now, there's much more work going on quantifying the benefits of programs. This is like, I think our last year of data was 2020, and so that last period goes through the 2010s up through 2020, and we see now, many more papers being written on studying the benefits of programs compared to studying the incentive effects. So it's a really interesting time to be doing this work. There's, with the explosion of availability of administrative data and this kind of lens of like, oh wow, we studied this program in the short run, I wonder what it means for the long run, has really broken up. And I think it's a really exciting time where we're really learning a lot. So in the very beginning of this study of the long-term benefits, the theoretical lens about why resources might matter in childhood and how that might translate to adult outcomes was very centered in the theorizing from a literature that was very based on nutrition. And in particular, the fetal origins hypothesis, or the Barker hypothesis, named after one of the early developers of this theorizing. And also, so there's been quite a lot of attention to thinking about the importance physiologically of what it means to not have good nutrition in early life, and how that can have, and has been documented, to have adverse impacts on health outcomes sort of in adulthood. A lot of the early work in that area was fairly correlational, but no longer. There's a lot of incredible work documenting the relationship between early life shocks and later life outcomes. And the study of the social safety net in the long term sort of came in as there was this explosion of work in economics studying the sort of long-term impacts of these early life shocks. So you can sort of see how studying the social safety net really kind of was a natural extension of those thoughts. And so, but I think that the study of the social safety net brings in a different lens than had really been the focus in this work on the fetal origins hypothesis and early life shocks in a couple of ways. One is that most of the work in this early area of the importance of early life shocks was very focused on negative things. Famines, that was where the first work had been done. And then in a lot of work in environmental domains, pollution, other kinds of things. So I think the social safety net brings in a policy manipulated positive thing, Also, something that's more modest. It's like increasing food stamps is not the same as a famine. Like those are two very different things. So the way in which the social safety net sort of enters in a kind of theorizing way, this thinking about why early life might matter, I think is both, well, it's of course relevant for thinking about the problem that I'm talking about today, but how it's kind of situated into this broader set of findings in literature, I think is also important. So now with that sort of a little bit of history and a little bit of backdrop, what I want to do is just take some time to sort of give you a bit of a review of some of the work that folks have been doing in this area. And so I'm going to kind of split my review up into some different categories. So I'm going to first talk about what we know from cash assistance. And then I'm going to talk about what we know, well, I don't remember what comes after that. I think tax credits, and then maybe Medicaid, and then food stamps, I think might be the order if I remember correctly. So let's start with cash assistance. So I think one of the most ambitious in terms of life cycle papers that I've seen on this is work by Iser and co-authors that goes back to really the first cash assistance program in the United States that was an anti-poverty program, and it was not available nationwide. It was kind of before the birth of, quote, modern cash assistance, which started in the United States in 1935 as part of the Social Security Act, the Aid to Families with Dependent Children program. So before the AFDC program was something called the Mother's Pension Program. And the Mother's Pension Program gave cash assistance to very poor women who did not have a husband. There was no father of the children. And what these very resourceful labor economist and economic historian team did in order to study this program is, first of all, they digitized a lot of archival data. And secondly, they actually found the digital records of the original social welfare professionals who were determining by handwritten notes whether or not somebody who came in was eligible for the program was going to get it. And so they ended up using a research design that compared folks that got the program to those that applied and were denied. Now, that's not random assignment, but if anything, you would think that those that got the program would be more needy than those that didn't, and so it might actually be biased away from finding an effect of the program. But that's what they were able to do in terms of trying to identify the effects of the program. The cool thing about this project, and it's the fact that the program existed in the early 1900s, was that people have lived lives and long lives and passed away, so you can really see their entire lifetime. And so what they find in this work, they look at the children, they look at the effects of the children in the long run, and what they find is that those kids that got this cash assistance compared to those who tried but were denied lived longer. For the sample of men, because of war records, they were able to have measures of the risk of being underweight, because that's a standard thing that is measured when you go and enlist into the armed forces. The risk of being underweight for the male subsample was reduced by half. So really large effects on being underweight. Also, they found increases in educational attainment. I think they got that from census records that were available in some states in this early period, and increased income in adulthood. So, robust increases in outcomes for these kids. This is one, I try to get a graphic from a paper, if possible, to try to illustrate it. You can sort of see on this, on the graph on the bottom one, is just showing you that you could sort of see where the educational attainment increased. So the blue bar are those that got the benefit, so less of those kids ended up with an 8th grade education, and more of them ended up with 12 years of education, is sort of what you can see in that simple graph. So that's one paper. There's another really interesting whole research agenda that I'll briefly describe. So Randy Aki at UCLA and his co-authors have been doing this very interesting work in the United States studying Native communities. And it turns out that in 1989, Native communities in the United States were allowed to have casinos on their lands. But they had to submit reports to the Office of Indian Affairs, as it's called, in order to have what they're going to do with the proceeds from those casinos kind of approved, building schools, public health clinics, and so on. It turns out that some of these Native communities created, essentially a universal basic income with the profits from their casinos. And so the very early work on this by Aki and co-authors studied just one Native community, because it turns out that there was a longitudinal study in the field that covered this community, amazingly, by some anthropologists who he teamed up with, interdisciplinary research, to do this work. And so they basically followed the children in a kind of cohort study, both comparing the Native community children across cohorts that did and didn't receive the benefit to those children who lived in a similar community, was like the East Smoky Mountain region, who were not part of the Native community. And from that work found that kids that had access to these additional resources in childhood, again, better education and lower contact with the criminal justice system. And what Randy and his co-authors are doing now is they've managed to get data on many more Native communities, reading through these Indian Affairs documents, identifying the communities that had these basic income programs, and are merging that data with United States data on tax records to do a much bigger data, deeper dive into this. And so I think they're hoping to have a working paper soon available on that work. So really interesting and exciting work. So another aspect of this kind of cash welfare is a more disruptive element, welfare reform. And so, many in Canada and the United States, we've had a lot of disruption to these cash assistance programs. It's a little bit less clear what we're measuring here. It's not just a simple more income, less income situation, because there's kind of many things bundled with it. But in work on the welfare reform here in British Columbia, which David Green is a co-author on this Hicks et al. Paper, finds that the 2002 welfare reform here in BC, had sort of some mixed findings for the long-term impacts on kids. So no impact on changes in their education, these children's education, or involvement with the criminal justice system in adulthood. So a kind of null finding there, but did find that those children themselves were less likely to be participating in cash assistance as adults, which, if you take that as a marker of disadvantage, would say that they became less disadvantaged. That would be one reading of those results. I myself am involved in a project where we're pooling randomized controlled trial evidence from 6 different large demonstration projects in the United States, which sort of predated federal welfare reform in the United States, where we've got these 6 different sites that sort of varied in what their welfare reform did, how punitive it was, how much they give you income on the way of essentially discouraging you from participating. And we're merging that with tax data and criminal justice data in order to try to understand how welfare reform affects kids' outcomes in the long run, but trying to unpack the mechanisms that might operate through changes in income versus changes in maternal labor force participation and the effect of participating in welfare itself. So I think we're sort of on the cusp to learn a lot about welfare reform. So there's definitely some studies that I'm going to talk about today where we do not find that more resources help kids' outcomes in the long run. And so one very simple to illustrate example of that is some recent work by Hawkins et al. That studies the SSI program in the United States, which is a cash assistance program that is targeted at the disabled population and elderly who are poor in the United States. And so they're studying in particular children who receive cash assistance through the disability SSI program. And it turns out that if you are born with a birth weight of under 1,200 grams, which is lower than very low. So low birth weight's 2,500 grams, or at least in the United States, that's how we measure it. 1,500 grams is what we call very low birth weight. So 1,200 grams is lower than that. And it turns out that if your birth weight is below that, you kind of get an expedited push towards eligibility for this program. And so what they do is link up birth records that contain this precise measurement of birth weight to decades later tax records and other records looking at those kids' outcomes. And here's what they find. It's in some ways, very simple to see visually. They do a regression discontinuity approach to study this. So first look at the top panel. You can see okay, something's happening there. What is happening? So what is on the horizontal axis, which you probably can't read, I certainly can't, is birth weight. And the vertical line there in the middle is that 1,200 grams. So they're plotting there these kids' birth weight at birth, and the dots are just the bins of the means for different little categories of that. And then the vertical axis on the top is what we would call the first stage, that is participation in this program. So it might be on the books that if your birth weight's less than 1,200 grams, you're more likely to get this program, but do they? We don't know until you plot the data. So the top one shows that indeed, if your birth weight is below 1,200 grams, you've got a much higher rate of participating in SSI. And sort of the cool thing about this approach, apologies for those who know a lot about it, is that it's like whether you're just above 1,200 grams or just below 1,200 grams is kind of random. And so we've got these kind of automatic treatment and control comparisons that is chef's kiss, amazing. We love that. As long as, it's bad, 1,200 grams is very scary, but it's really good for research designs. And so they leverage that first stage and then say, okay, now I observe these people 30 years later, how different are their outcomes? If we've established there that they do get more resources. And so what you can see on the bottom is, the second one is, do they have any earnings? Maybe that's not that exciting. The third one is, what is the level of their earnings? That's a really important marker of your human capital, your ability to work. And the last one is, do you receive SSI as an adult? That would be a marker of still being low income because it's a targeted program. And so what you can see are very kind of smooth lines through that discontinuity. And so the conclusion here is that this program, this threshold, pushes more people onto SSI, but that doesn't really change kids' long-run outcomes. And the authors, I have just a quote up here just straight from the paper where they say, we recognize that there's many studies that show that resources in early life translate to improvements in these outcomes. Maybe that's not sufficient for a population that has greater barriers because of these physical limitations. It's speculation, but it's not a panacea in all cases, obviously, to state the obvious. So that's a little bit on cash assistance. Very close to cash assistance is essentially cash assistance that operates through the tax system, rather than tax system that operates through the kind of transfer and program development system. So here is where there's really been a growth very much in the United States and also in Canada in terms of providing more assistance directly as administered by the tax authorities. And so we have a lot of evidence from these programs because, one, they've been around for several decades, and two, there's been a lot of messing around with them, expanding them, which presents opportunities for trying to, tease out the causal effects of the program from all the other things that are going on that affects kids' lives. So with respect to the US program, the Earned Income Tax Credit, this is the largest anti-poverty program for children in America. Such as our anti-poverty programs are, they work well, the ones we have, as I showed you earlier, they're just pretty underfunded. So the Earned Income Tax Credit transfers maybe if you're a mom with 2 kids earning minimum wage in the United States, you would get about $5,000 to $6,000 American per year in terms of through a lump sum tax refund, typically arrives in February. And that $5,000 to $6,000 is a large number relative to your earnings. So it might be 30% of your gross earnings. So that's the Earned Income Tax Credit. An interesting thing about thinking about the long-term effects of the earned income tax credit for children is it's not just a helicopter drop of cash. Because the structure of the US program, you don't get it unless you work. And so essentially, you have impacts of this program that could both be operating through more money, but it's also sort of goes along with mom working more. And so depending on the circumstances, those things might have the same sign or they might have different signs. It's actually really kind of often hard to unpack those two channels. So we have a lot of evidence showing the impacts of the earned income tax credit on long-term outcomes. And I've sort of just given you a little bit of a thumb sketch of these sort of ordered across the life cycle. So more earned income tax credit leads to better improvement in test scores as kids make their way through school. It leads to higher rates of education at grade 12 and more college going. Maybe one mechanism for the additional, there's sort of two things that are measured in the research. There is when I have more resources when I'm younger child, that seems to translate to better education outcomes, but there's also a sort of contemporaneous effect. If I get a larger earned income tax credit when I'm sort of on the cusp of being college going, it might help maybe break some liquidity problems that improves that transition from high school to college. There's evidence showing that there's improvements in earnings outcomes in adulthood. These kids are still pretty young, given when these policy changes were taking place. And while not with respect to the kids, there's also some very interesting evidence about how maternal stress, in part as measured through biomarkers, sort of stress biomarkers, seems to improve when there's more resources in the family. And so this is another potential channel of some of the kind of long-term effects of poverty and how it might operate through the stress of your parents in dealing with that scarcity. So let me show you some pictures from one recent study that I think really illustrates this well. So I'm sure that, how many people in here, you still fill out tax forms in Canada? Okay, so you can fill out your tax form. So if you have children, Raf here would know that, we were just talking about your two kids. What matters in the United States anyways is just the presence and number of children as of December 31st, the end of the tax year. So what's interesting in this study is they leverage first births among a bunch of people in the whole United States, and they essentially compare people who happen to have first birth just before the end of the year versus in the next calendar year. And what they study is simply 1 year of child benefits. So if I have a kid who's born in December, I basically get my first year of child benefits through the earned income tax credit in February when I get my tax refund for that calendar year that's just going to arrive a few months later. But if I have my first birth in January, I have to wait a whole nother year to get that first set of tax benefits. So we do not disperse this monthly and in anticipation. That's just the way this program is structured. And so what they essentially do is study, again, using administrative data on all births in the United States linked to tax records, and essentially compare those that are born just before the end of the year and just after the first of the year. And so they're only isolating just 1 year of benefits, which I think averages in their sample something like $1,500. There's some higher income people who get lower amounts, some lower income people who get higher amounts. So it's essentially it's a very nice example of isolating, it's small, right? So it's not like a whole lifetime, but it's a kind of nice isolation of showing the impacts that is much harder to see in these studies. I should just say that a challenge in this work is you're having to aggregate across childhood in exposure to a lot of different policies to translate outcomes in adulthood. it's messy stuff. It's like some sausage making. It's not always pretty, but you do the best you can. This is doing something quite different. It's isolating just 1 year worth of benefits. And so here's the first graph on the left is again sort of showing you that first stage. So if you're born, so now you get the money if you're on the left side of the line. I guess that was the same as in the SSI example. And so this is just plotting out, well, I guess you can see the mean effect because that's actually in this graph. So I wasn't too far off. It looks like it's like $1,200 that those that are born near the end of the year get compared to what those that are born just after in the beginning of the year. And then what they do is then go forward and measure outcomes in adulthood, which I think is maybe around age 26 in the study, if I remember correctly. And so what I'm showing you here is effect on, nope, it's right there, 23 to 25. I was in the ballpark. And what you can see here is that the effects on women, so they've split it out by boys and girls, and you can see that they've got a statistically significant improvement in earnings if you have more income. Like, I'm not showing that here, but that is statistically significant, but it's pretty small. But if you look on the right for the men, you notice a couple things. First of all, overall, their earnings are lower. Men are on average earning less than women in the sample. But you can see that those that are born and have that 1 year of additional benefits have higher earnings. It's a detectable improvement in earnings between ages 23 and 25 from having $1,200, $1,300 more dollars in the first year of life. I mean, it's a very specific thing, but it's kind of where we're starting right now in this kind of work. They also show that, and you can see that the confidence intervals get wider here because they don't have as much data, but it might be the case that these impacts might be growing. 23 to 25, that's the estimate I just showed you, and you can see, in measuring out through up to ages 32 to 34. So that gives you a kind of a sampling of what we've learned from the work on the earned income tax credit. And we have work from the Canadian child benefit as well that Kevin and Mark Stabile have worked on much earlier, actually, the earlier work in 2011, showing that using variation sort of across provinces and over time in the generosity of these child benefits and how they were administered throughout Canada. And then once again, relating those childhood differences in exposure and access to these different programs and connecting them to child outcomes. And so what they find is improvements in the mental health of both children and moms, as well as some improvement in children's physical well-being. And they find for boys, though not for girls, interestingly, similar to the previous example that I just showed, having more resources through these additional child benefits in childhood improves test scores and educational outcomes for the boys, but not the girls. So there's a lot of work that's going on with these kind of child tax credit type things. Something that you wouldn't see in Canada, but you see a lot of in the United States, is the study of our, I think of as an anti-poverty program, but maybe not everybody does, and that is our public health insurance system for low-income families, which is called Medicaid. And so, if your income is below a given level, you can get coverage through this program. And way back in the day when Medicaid was first started, only a very small section of the population would receive it. You essentially had to receive cash benefits through either AFDC, the old cash welfare system, or SSI, the one I was telling you about, and they would lop on top of that access to public health insurance. But there was a lot of interest in trying to facilitate moving folks, like maybe there's ways in which if we load all these benefits on top of something that's very targeted at low incomes, it might be harder to kind of earn your way to independence because of all these benefits sort of stacked on top. And so there was an interest in expanding public health insurance beyond that point. And so there's actually been quite a lot of expansion of Medicaid prior to Obamacare, which is much more recent. But the earlier wave of expansions sort of started in the mid-1980s under the first Bush president in the United States and continued through the 90s and was focused on kids and pregnant women. And so here's a graph that Andrew Goodman Bacon put together. And if you look at the triangles, the gold triangles, it traces out the share of children who participate in this program. And it was a part of, Lyndon Johnson's Great Society in the mid-1960s when Medicaid launched, but it was pretty small. And you can see that starting in that late 1980s period, there's this real increase in the share of children who now are getting public health insurance through Medicaid. Now, some of them previously had private health insurance, so this isn't all new insurance. The uninsured rate for children overall, so the share of children who don't have health insurance, is in those blue circles, and you see that goes down, but not as sharply as Medicaid goes up. However, if you sort of redo this graph and focus on the lower income population, I don't have quite as pretty or as long a time series on this, you can see that if you focus on those who are poor or near poor, that's like under 150% of our poverty line, you can see that this is how much the rate of uninsurance went down. So it's like a 15 percentage point decline in the share of children who don't have public health. I'm sure you're all looking at that and going, I can't believe that's not zero. It's not, but this is a big shift. So this expansion in Medicaid there are dozens and dozens of papers that study. I mentioned that Curry and Gruber early work, which was the first paper I remember seeing that quantified the benefits of a program expansion, and this is the program that they studied. But there's been recently a real explosion of not the short-term effects of this program, but the long-term effects, and not just effects on health, but also effects on economic outcomes. And it is remarkable. This program generates so much in the way of benefits that it fully pays for itself in the long run. That is, the additional, not how it's good for the families, but the costs on the government ledger. So the government needs to spend money today on health insurance. In the future, they're kind of paid back if I earn more, pay more taxes, et cetera. Public health insurance for children is basically the biggest ROI, return on investment, of anything I'm talking about today. It's not very expensive, and it yields really high returns. So high that it pays for itself. And nothing else that I'm talking about today pays for itself. There are high returns, but it doesn't fully pay for itself. So we have evidence that providing more health insurance for kids in childhood improves their health in the teen years, in the early adult years, and we also have impacts on economic outcomes, improving the share that graduate from high school and transition to college. And there's a recent paper that actually looks at the children of the children who were born and aided by Medicaid. So I'm a pregnant woman, I get Medicaid, I have a healthier birth. Okay, so I'm Hilary, I have a daughter named Sarah. Sarah has a healthier birth. My Sarah doesn't have a child yet. I hope she does one day. So when Sarah has a kid, the question is how healthy is her birth? There's a paper that's forthcoming or just came out in the QJE that shows that when the mom, or the grandmother, receives Medicaid, the granddaughter or grandson is healthier at birth. And it's like, I think about half the magnitude of the effect on the first generation. So, these are potentially long-lived intergenerational benefits of this program. So let me just show you a couple of figures from some of the work on this. A lot of the studies use, again, I'm showing you a lot of regression discontinuity graphs, I realized in retrospect, because they're just really easy they're pretty graphs, easy to show. easy to communicate. So I'm going to show you another regression discontinuity set of findings. So when Congress first started passing these laws, the very first one they passed was in the fall of 1983. And so that very first act only covered kids who were born then or later. They weren't grandfathering in all kids who were already born to save money, presumably. And then after that, there was a lot of subsequent expansions to Medicaid, but they kept that age restriction in there that compelled states to do this coverage, and they had to cover kids who were born October 1st, 1983 or later. And so that, once again, lends itself to a nice setting in order to look at long-term outcomes, and all you need to know is when was the kid born. I mean, it's quite born, which is quite handy. So there's work that shows that having access to public health insurance in childhood means you're less likely to show up in the hospital this is like in young adulthood, in the early 20s. So this isn't the direct effect right now of having insurance. It's about the effect between childhood and early adulthood. And you can see that the effects are concentrated on a reduction in hospitalization for chronic conditions and not other things, which is kind of consistent with what it would mean to have access to health care. And you can see that there's effects that are concentrated among Black children, or now young adults, and not white children, which we don't know for sure, but we think is primarily because they're more likely to be treated by this program, because on average, Black children, another racial inequality in the United States is Black children are on average have higher poverty than white children. And unfortunately, in a lot of our administrative data, we don't have the data far back enough to know how much income the families had back when they were getting these programs. So we're really doing a very kind of deep reduced form of just date of birth and outcomes without really knowing how likely you were to even have participated in the program. It's kind of it's a weakness of the work, but it's kind of what we have. So I think that's the reason why we think that there are effects concentrated for Black and not white children. You also see lower rates of mortality in later teen years for this population as well, which is important. And a recent study shows that using data from just one state, from the state of Florida, shows that children who have access to Medicaid, so now those that have access, they're on the right side of that vertical line because they're born after September 30th, 1983. And so you can see on the left side of this graph, Black children, I think this is all men actually, Black men who have access to Medicaid in childhood are less likely to have contact with the criminal justice system in early adulthood by age 25 or something like that. I'm currently working on a project where we're taking the same design and bringing it to all states in the United States, not just Florida, and also expanding beyond looking just at criminal justice outcomes. So I'm just getting started on that, so stay tuned for that. Yeah?
So do you know whether diabetes is involved? Because that would be one illness that would be consistent with all of the outcomes.
Yeah. I don't know, in the hospital data, you can definitely observe reason for hospitalization. I've not seen it broken down. I don't know if they're just not powered up to go any further to go inside these chronic conditions. But I don't know if there's a study that does that I haven't seen. It's possible. Because that would certainly be a high share of those chronic conditions for someone in their 20s. It's not gonna be heart disease and, high blood pressure as commonly. So yeah, thanks for that. So that's what we know about the Medicaid program. So let me end by, not quite done, I shouldn't say that. The last category is work on the food stamp program, and that's an area where I've been doing a lot of work. So in the United States, we've got something that is not quite cash, but is as close to cash as it can be without being cash, which is vouchers to buy food at the grocery store. And this program, believe it or not, is the second largest anti-poverty program for children in America, because it's so much more prevalent than getting cash assistance in the United States. So the EITC is the highest, and then the SNAP program, or food stamps, is the second largest. And like Medicaid, the food stamp program was started as part of the War on Poverty and Great Society period in the mid-1960s. And what I leverage in the work that I've been doing on this is the interesting historical event that when food stamps was made available across the United States, it took about 15 years between the very first counties that got this program and the last counties that got this program. And there's a lot of counties in the United States. There's small geographic units. There's like 3,100 of them in the United States. And so in our data, we observe someone in adulthood, and I observe when they were born. I have their date of birth, and I observe where they were born, in what county of birth. And with that, I can sort of construct an endowment of sorts of what share of their childhood did they have access to food stamps? Was it in place in my county before I was born, so I had access to it my whole life? Or did it come in when I was 5 years old, or 2, or 10? And so we leverage that information in a sort of a county rollout sort of design. And so I'll show you a couple of figures from that, and then I'll wrap up. So we observe kids in adulthood, and we observe various measures of their human capital. And this is just sort of like a summary index of different kinds of human capital, what your education level is, whether you have a professional occupation, and so on. And on the horizontal axis is how old were you when food stamps was made available in your county of birth? And so this takes a few more words than describing the, trying to see if there's a button on this. No, there isn't, that's okay. Whoops, not that. So where the red box is kind of the omitted year. So whenever you do a sort of event study, there's always an omitted year. So what we're trying to ask is, if you have access to food stamps earlier in your childhood, does that lead to better outcomes in adulthood? So the event graph here shows your human capital. That's a good thing. So more of that is good, relative to having access at age 10. That's inside that red box, and is 0 by construction. So everything is relative to that. So here's what you see here. First of all, to the right of age 10, or maybe even for a few years before that, it's a pretty flat line. What does that mean? It means that if food stamps was first introduced in my county of birth at age 12, or age 10, or age 8, my long-term outcomes aren't very different. It's a flat line. But once you get to this kind of earlier childhood years, for reasons I don't fully understand, you can see almost like a dose response, sort of linear relationship. So that if I get first exposed to food stamps at age 5, or age 3, or age 1, as I get exposed earlier, and therefore longer, my human capital improves. So it's sort of flat, and then it goes up, but then it gets sort of flat-ish again. And what that is trying to explore is, well, if food stamps was in place 5 years before I was born, or 3 years before I was born, or 1 year before I was born, it shouldn't matter. I've treated my whole life. And so there shouldn't be differences across those kids. So it's part of the way you try to test whether or not this is a valid kind of research designed to study. So the punchline from this is more food stamps, better health outcomes. But in particular, more food stamps in early childhood translates to better outcomes. And it may be that there's something particular about the nutritional sort of lens that food stamps is, where it's more concentrated in early childhood. But I don't know, more work will tell. We also see the same sort of pattern, flat, increase, flat. So more food stamps, more food stamps in early childhood, better for kids in the long run when we look at a quite wide range of outcomes. The quality of the neighborhood in which you live, what your earnings are, what your own sort of poverty is in adulthood, your connection with the criminal justice system, and mortality. Although these folks are still only like in their 50s, if you think about like being treated in the mid 60s to mid 70s. Like I was born in 1961, I'm 63. So these people are still pretty young. So we'll learn more as they get older. But the bottom line is there's sort of a not huge, but a quite broad set of improved outcomes for these kids. And in a separate paper, we looked at the risk of having metabolic syndrome in adulthood, which is like diabetes, high blood pressure, heart disease, these kind of combinations of outcomes. And the reason why we looked at this is that, to go all the way back to the beginning of the talk, the original fetal origins Barker hypothesis showed that when you had poor nutrition in early life, you had a greater risk of metabolic disease in adulthood, like post-reproductive age, like we need to survive to reproduce, and then you'd have a higher risk of metabolic disease. And so what we find is that getting access to food stamps, again, in early childhood, leads to, so metabolic disease is bad, so a reduction in the risk of metabolic disease is good, so more food stamps in early life leads to a reduction in metabolic disease in adulthood. And again, it doesn't matter at the older ages, and is very concentrated in those early years. So that's some of the work that I've been doing on the food stamp program. So let me wrap it up by sort of putting this all together and trying to get back to why do we care? How is this useful? So there's a tool that's very commonly used in studying programs and their benefits relative to their costs, called the marginal value of public funds. And that is just a ratio of a benefit in the numerator and a cost in the denominator. And in the denominator, that cost variable is how much we spent on this program, but then net of these incentive effects that I talked about earlier. So if I distribute some money in an assistance program that along the way people earn less, then it's more costly for me to deliver $100 to that family. And that's why it's important to measure that. It's just part of the costs. So that's sort of what's in the denominator, the cost measure. But it also includes, basically it's everything on the government budget. So if in the future I earn more and I pay more taxes, then that's like offsetting the costs in the denominator. So we've got to pay for this program, but over time you might get some returns by that on the government budget. So when I said the program pays for itself, it's sort of when this denominator hits zero and then this ratio hits infinity. The numerator is sort of the family's private benefit. So it's our quantification of how the program benefits you. So my earnings are higher, that's good for me. My mortality is lower, that's good for me. So all the things in the numerator are sort of the private benefits, and then the denominator are the government costs. That's what the marginal value of public funds is. So if I take my food stamp work that I just showed you, we end up with a marginal value of public funds of 56, which is pretty high. And most of that numerator that gets the 56 relative to the $1 of cost comes from lowered mortality. Because with a high value of statistical life, you can get pretty large numbers. If we ignore the mortality effect and just focus on earnings and things of that sort, our number is more like 5. So admittedly, the mortality is a big part of this. But the key thing is it's like way over 1. So the benefits relative to the costs are greater than 1. And the costs, the impact, you have to spend money on the program, but we got to account for the fact that parents might adjust their labor earnings. But the government gets paid back. The things we're able to quantify are all the tax stuff, plus less incarceration means less spending in the future. What if I didn't do all this work on the benefits and we just were in the old world where we were only studying the incentive effects of the program? I would have a marginal value of public funds of 0.69. And so essentially what we were doing back in the day was just measuring these wedges, like to what extent when I transfer $1 to you, do I end up getting less than $1 worth of anti-poverty fighting? That's what it is. And that's not unimportant, like it's important to know that. But I think where I sit today is it's only important to know that in the context of what benefits it generates. If it doesn't generate any benefits, then I'm not sure it's worth doing. But maybe you can have a really distortionary program that generates big benefits, and maybe you decide that's really worth doing. But you won't know that until you quantify the benefits. So there's this really terrific study by Hendren and Sprung-Kieser that takes the same MVPF and takes more than 100 different papers and policies and tries to calculate this measure in the same way. And they do it, there's a lot to digest here. You're welcome to go to the paper and look at it more. But they break it up into the kind of program it is. And as you can see on the horizontal axis, they break it up into how old are the recipients. So there's this like, are all programs more create a higher return on investment if we target them at children compared to adults? Some, yeah, a lot of them. You can see these really young kid beneficiaries have pretty high returns, but there's some exceptions to that. So that's where I want to end. We've got to do the work of quantifying these things in order to step back and put it together and ask, like, are we doing enough with the social safety net? These are leading to high returns. And the question I have, because I do spend some time talking to staffers and other people, is kind of thinking about the social safety net as an investment in children a way to get more people on board for this being something that we should be doing in a rich economy like my own, the United States. So I'm more than happy to take questions. I'm not going to go over this slide, but for the PhD students in the room, these are some things I think that are like really out there of things that we don't know and need more work on. So thank you very much.